The purpose of my speech is to persuade you to believe that the United States should have universal health care coverage for multiple reasons, and these are just a few. I feel as though it is important to provide health care to all, regardless of income or health status. The ability to provide health care and quality health care should not be determined by anything other than who was in line first. In 2021, the United States had reported 19.1 million cases of depression, while in Sweden, where universal health care coverage is available, they had just over 500,000 reported cases of depression. I personally believe that having access to care needed sways these types of things. There would be less depression, lower bankruptcy rates for those who had no choice but to pay medical expenses, less debt and medical bills for those who had access to free health care, higher credit scores, the potential to have more for yourself rather than dumping what you have into medical expenses and prescription expenses. Universal health care refers to a system in which all residents of a country have guaranteed access to health services, often through government-funded medical insurance. This concept has been a subject of debate in the United States, which remains one of few developed countries that actually has universal health care coverage. While we have had a few various somewhat similar forms of coverage by Theodore Roosevelt and Barack Obama, supporters argue that the basic health care is a human right, while critics raise concerns about the government's involvement in potentially limiting personal choice and increasing costs. This would ensure that everyone is receiving what they need without judgment that comes from having no health care coverage, pushing them further and further back on wait lists. While some doctors provide some type of sliding scale which would offer discount prices for those who don't have coverage, many are denied for the simple fact of making too much money. But if they had too much money, they would have health coverage and they wouldn't be asking for help. Offering universal health care would eliminate these issues because no one would be denied proper health care, as the clinics and hospitals would be getting paid regardless of insurance and employment status. Two primary models exist for universal health care: a single-payer system where the government covers all medical costs, and a socialized medical model where the government owns and operates healthcare facilities. Additionally, hybrid models combine elements of public and private funding. The ongoing debate reflects broader political divisions, with some advocating for more comprehensive systems similar to those in Canada or Japan, while others fear that universal coverage might undermine the competitive nature of the American healthcare industry. The insured are more likely to delay necessary care. The uninsured are more likely to delay necessary care, suffering from preventable diseases and facing financial ruin due to medical expenses. Meanwhile, hospitals and charitable clinics bear a significant economic burden as they provide uncompensated care. Addressing the uninsured crisis requires systemic changes, including policy reforms and innovative healthcare solutions. This source explains the struggles that come with being uninsured, both for the patient and the healthcare system. The most effective change I believe that would help would be to offer a basic type of coverage that allows those to be effectively taking care of themselves medically. Many have to choose between paying proper day-to-day expenses or choosing to pay for a prescription. Without insurance, individuals are likely to seek preventative care services, leading to undiagnosed and untreated medical conditions. For example, chronic diseases such as diabetes, hypertension, and cancer often progress to severe stages before an uninsured patient seeks medical attention. Lack of routine checkups and screenings result in poorer health outcomes and higher mortality rates. The life expectancy in countries that offer universal healthcare coverage is much higher than we have here in the United States because they can get proper care for all of their medical needs. Medical expenses are a leading cause of financial hardship among the uninsured individuals. Without the protective coverage of insurance, patients must pay out of pocket for doctor's visits, emergency care, and hospital stays. A single medical emergency, such as a heart attack or an unexpected surgery, can lead to medical bills amounting in tens of thousands of dollars. Many uninsured individuals resort to taking on medical debt, depleting savings, or even filing bankruptcy on their homes to help cover their health care costs. Medical bills are the leading cause of bankruptcy in the United States, with nearly 62% of bankruptcies attributed to medical debt, says Alexander in 2022. According to a study, nearly 62% of bankruptcies filed were due to medical expenses, causing Americans to lose their homes and cars, as if struggling with medical attention wasn't hard enough. Now some are homeless, without a vehicle to get back and forth to work to even maintain some type of normalcy in their life and survive. Medical debt can accumulate quickly, and for most, it is completely unseen circumstances. Amongst the poorer people in the United States, many make hard choices between the purchase of their next meal and making the purchase of their copay. Whether it is for an appointment copay or a medication copay, many drain their savings, moving to another state to have cheaper medical expenses. The United States is number one in bankruptcies caused by medical debt, with the leading number being 66.5%. As it turns out, medical bankruptcy is the almost unheard of outside of the United States. Other developed economies, except China, have single-payer healthcare system where medical costs are financed by taxes. I personally feel as though depression rates would be lower here in the United States if we had universal health care, because it would be easier to treat with the access to the correct resources. In 2021, Sweden, whom has universal health care, had just over 500,000 cases of depression, while the United States had over 19 million cases. Not only would we be able to take care of ourselves medically, but we could potentially provide for ourselves financially, putting more money into the pockets of Americans rather than the pockets of those who are already financially stable.